I'm Kara Johnson, and this is my informative speech. Having a baby before the due date can be scary, and even scarier when the due date isn't even close. I'm going to talk to you about preterm labor. I feel that I'm credible to talk about this topic because I'm currently in preterm labor at 25 weeks. I had preterm labor with my daughter 5 years ago, and I'm a registered nurse. I'm going to inform you about what exactly preterm labor is, the causes, the symptoms, and the treatment of preterm labor. Normal pregnancy is about 40 weeks. Preterm labor is labor that is between 20 weeks and 37 weeks. Before 20 weeks of pregnancy, it's called a threatened abortion or a miscarriage. After 37 weeks pregnant, it's just regular labor. Preterm labor causes contractions that change the cervix. Now I'm going to talk to you about the causes of preterm labor. American Pregnancy states the causes of preterm labor include a combination of medical factors, lifestyle factors, or other factors. Medical factors include high blood pressure, being overweight or underweight, STDs, previous abortions, short times in between pregnancies, and infections. Lifestyle factors include drugs, alcohol, and smoking. Other factors include being pregnant with multiple babies at one time, previous premature births, or uterine or cervical abnormalities. Next, I'm going to tell you about the symptoms of preterm labor. The symptoms of preterm labor are like that of regular labor. The hallmark sign is usually contractions. Contractions are tightening and hardening of the uterus. If the contractions are regular, they happen at least once every 10 minutes for at least an hour. These regular contractions cause cervical changes. According to WebMD Online, symptoms include low backache, cramping, fluid leaking from the vagina, increase in pelvic pressure, increased vaginal discharge, and vaginal bleeding. And sometimes there isn't an exact cause of preterm labor. Next, I'm going to tell you about the treatment. The treatment, or the goal of treatment for preterm labor is to stop it. This can be attempted in a few different ways. Some treatment doesn't stop preterm labor, but it helps you stay pregnant longer, keeping the baby as healthy as possible. The first step of treatment is to treat the cause. If preterm labor is caused by an infection, you treat the infection first in hopes that the preterm labor will stop. Also, this can be managing lifestyle choices like quitting using drugs, alcohol, or smoking. A lot of the time, medication is used for preterm labor. One of the most common ones, or one that's becoming more common, is the use of progesterone during pregnancy. When progesterone levels are low, this could cause the uterus to act funny and go into preterm labor. I am currently on the maximum dose of progesterone each week. I take 4 shots each week to help prevent my preterm labor. Other medications you can take are tocolytics. Healthline.com reports that tocolytics are medications that delay labor. There are many different kinds of tocolytics, but the most common ones are terbutaline and Procardia. This is Procardia. Sometimes when you're in preterm labor, the cervix starts to open. A cerclage is a stitch in the cervix that holds the two sides of the cervix together in an attempt to keep it together for the pregnancy. Along with medications, you are usually also on bed rest or pelvic rest. Pelvic rest is no sexual activity. Bed rest is pretty much just not doing anything and relaxing all the time. In conclusion, I have now informed you about what preterm labor is, the symptoms, the causes, and the treatment of preterm labor. I hope you never have to worry about a baby being born too early, but if you do, I hope I have made you a bit more knowledgeable on this topic. Thank you.